also a very healthy new year for those Fitbit owners, and the nation's health is going to be, of course, in focus for President-elect Trump in the new year as well. For President Obama, because it was his legacy act, but it's target numero uno as Team Trump looks towards deregulation. Fox Business senior Washington correspondent Peter Barnes has the inside details of the future for the Affordable Care Act. Peter.
Well, Obamacare has been one of President-elect Trump's top targets.
We will repeal the disaster known as Obamacare and create new health care, all sorts of reforms that work for you and your family. And we are going to be doing it properly.
President Obama has declared Obamacare a success, especially this month as consumers enrolled for coverage in 2017 and as Republicans threaten to scrap it.
One new study shows that if Congress repeals Obamacare as they've proposed, nearly 30 million Americans would lose their coverage. 30 million.
Analysts are looking at a 2015 Obamacare repeal plan for clues to how Mr. Trump may proceed on replacing it. It came from Republican Congressman Tom Price of Georgia, whom Mr. Trump has nominated to be his Secretary of Health and Human Services. Price's legislation would offer age-adjusted tax credits for the purchases of individual and family health insurance policies. It would encourage more people to contribute to health savings accounts. It would offer grants to states to subsidize insurance for sicker people. It would allow sales of health insurance policies across state lines to promote competition, and it would allow small businesses to band together in professional associations to purchase and provide coverage to members through association health plans. But making changes to Obamacare could get complicated.
For those that have been in place and are in effect, the only two ways to eliminate or modify them are through statutory change, so Congress writing new legislation that overrides those, or the President and the Secretary of HHS going through the normal rulemaking process, which would take at least a year.
Repeal and replace, at least as it's been described, seems to be a repeal and then a big pause and then some kind of replace that's very ill-described. And so it's sort of like telling people that, we'll push you out of a plane and then, hopefully we'll have a parachute before you land.
But at various points on the campaign trail, Mr. Trump expressed support for keeping some of the more popular provisions in Obamacare, such as the ban on denying coverage for people with pre-existing medical conditions.